everybody, this is your Shruthi ma'am, and today we're going to do a warm-up of the reproductive health chapter. Okay, now all the notes, everything that you need is available in our WhatsApp community. So without any delay, definitely do join in so that you can get all the notifications and all the notes at your fingertips. Okay, and from Xylem, if you are preparing for the NEET 2026 batch, then we have a fast track batch and currently having a 15% discount. So the mega 15 code can be used and you can start now and still crack your NEET exam in no time. Okay guys, and also if you would like to join our online batches, Thalapathy or the VETRI batch, which is for the 12th standard and the repeaters respectively, you can use the mega 30 code and get a 30% discount. Okay, so this is only limited time, so definitely if you are looking for the 2026 NEET preparation, then definitely do join in. Okay, so this warm-up session is going to help you to revise this entire reproductive health chapter. Now if you look at it, this chapter is mainly the first introduction, that is about what the government has done, what are the problems, strategies and other things. Contraceptives, very important part of the chapter. Most questions from this chapter come from the contraceptive parts only. Okay, then after that you have to study about the sexually transmitted infections, what is curable, what is not curable, how they are transmitted and all that. And lastly we will talk about infertility or the assisted reproductive technologies that can help a couple conceive if they are naturally not able to conceive. Okay, so that's all is the chapter. Now the specialty of this session is that I'm going to give you this warm up and also use tabular columns and flowcharts only for explanation. So once you join the WhatsApp community, you'll get this entire PDF and you can revise this chapter in just 10 minutes, not more than that. Okay, so it will be very useful for your last minute revision and for you to brush up all the important points. Okay, now starting with the reproductive health, the problems and the strategies. First thing is, India was one of the first countries to start the family planning program in 1951. Okay, and from the government we have a program called the Reproductive and Child Healthcare Program, called the RCH program, which looks at developing reproductive health as its only goal. Okay, so what is reproductive health? All aspects of reproduction should be healthy, which is physical, emotional, behavioral, everything together, and that is what will make a reproductively healthy society. Okay, now what all this RCH does is definitely creating awareness about reproductive health. Okay, then it provides all the facilities, support and everything needed for the society, like for example medical support, infrastructure support. There are so many towns and villages that don't have hospitals, so for them what has to be done, everything this RCH is taking care. And also family welfare and population control is one of the major departments of the RCH programs. Okay, so when it comes to awareness, they've spread a lot of awareness through audiovisual media, through print media, and through a lot of awareness campaigns. Parents, teachers, peers, everything, everybody is being guided. Sex education in school is done. Okay, then what all do they talk about? They talk about reproductive organs. Okay, what changes you can expect at puberty, what adolescence is, safe sexual practices, right? Then HIV, sexually transmitted diseases, infertility, all of these are things that they are educating on. And also why you should take care of a pregnant mother, what should be done prenatal, postnatal, which is before and after the birth of the child. Okay, then child vaccination, immunization programs, why breastfeeding is important. Okay, and also gender equality. We still see a lot of cases of female feticide and other things, so gender equality is a major thing. Now all of these things are under the RCH activities. Okay, and also awareness about population explosion, about sex crimes. Okay, then providing infrastructure support. Like I said, there are so many villages wherein children are being born inside the houses, which is not safe, right? So those kind of things they are trying to advocate and they are trying to make it better over time. And also the legal and ethical measures that have to be taken. For example, amniocentesis being used for sex determination and then doing female feticide, aborting the baby because it's a girl. So all this should not be done, and all this check is done by the RCH. Okay, now research and innovation is also a major thing. So from the RCH support, we have developed new drugs, like for example Saheli, within India itself in the CDRI Lucknow. Okay, Central Drug Research Institute in Lucknow. So these kind of new medications, new approaches will help us to make a betterment in the reproductive health. Okay, and also like I said, increasing sex education, okay, more medically assisted deliveries, okay, small families have increased, then improving the sexually transmitted diseases and treatment, okay, access to facilities, and all of these will help the country and the society to grow as a reproductively healthy society. Okay, now if you look at some stats, okay, the stats is very important because simple MCQs you can get, or just one word answers you can get, so it will be very easy if you are looking at this table. Okay, so world population was 2 billion, it became 6 billion, and within just 10 years it became 7.2 billion. But this is the stats we're looking at 2011. Today we are in 2025. Okay, so almost in 2026. So you can see how much of population explosion has happened. Now in India, if you see, 350 million was there during the independence time, but then after that it became 1 billion, and then 1.2 billion in 2011. Okay, now causes of population explosion, why this kind of population explosion happened, is because death rates reduced. Okay, so maternal death rates, infant death rates, everything reduced. There were better conditions, better health facilities, so people stopped dying. So as a result, population explosion happened. Okay, now population the reason, like if it happens in such a big rate, then what happens, even basics of what we need like food, shelter, water, all this becomes a major problem. Okay, so it becomes really really difficult to get even the basic needs for the people if the population is exploding in such a big rate. Okay, and need for control, because if there is overuse of resources, then again, like I said, the quality of life is going to deteriorate, right? So we need a strong population, we need a healthy population, instead of looking at very unhealthy population which is of no use. Okay, so that is the whole point. Now from the government measures, we have these slogans, right? Hum do, hamare do, and then small families are given incentives and those things. Then legal incentive measures is that legally marriage age is increased, so and also people are advised to have smaller families, right? Then contraceptives, we are educating people about contraceptives so that we can control the population. Okay, and also the different categories, whatever are there are many different options that people can go for, and that can help to control the population. Okay, now coming to contraceptives. Now this contraceptive meaning is all that we use to prevent any unwanted pregnancy. That is what we call as a contraceptive. Okay, now what is this contraceptive, or why should we use this? Because if every intercourse is going to lead to a child, then population explosion is going to be unlimited. So to control that, to prevent any unwanted pregnancy, the kind of measures we take is what we call as contraceptives. So different categories are there, of which the first category is natural method. So what do we do in the natural method? We are avoiding the chance of the ovum and the sperm meeting. That's all. So side effects is very less. There is no drug, device, nothing, which is going to avoid the chance of the ovum and the sperm meeting. So periodic abstinence is what, from days 10 to day 17 of the menstrual cycle is when in between we can expect the ovulation. So before and after few days, if there is no intercourse at all, then what will happen? At the time of ovulation, there is no sperm, so there is no chance of getting a conception at this particular period. Okay, that is periodic abstinence. Withdrawal is the male partner will withdraw the penis just before the ejaculation. So if the sperms are not deposited in the vagina, then there will be no sperms entering the female tract, and as a result there will be no pregnancy. Okay, so that is withdrawal, or also called as coitus interruptus. Then we have lactational amenorrhea, which is basically during the period of breastfeeding, the mother may not be ovulating because of the hormonal differences. So during this particular time, there is no ovulation, so there will be no chance of pregnancy also. But the thing is, this is only applicable up to 6 months postpartum. Okay, these three methods are the natural methods. Now when you look at barrier methods, here We are creating a barrier. So there is no physical meeting of the sperm and the ovum. Okay, so both males and females can adopt this kind of method. So condoms are the very frequently used barrier method. So it's a thin rubber latex, okay, which the male will use to cover the penis. Sometimes the female also can use this to cover the cervix just before the coitus. Okay, now not just preventing an unwanted pregnancy, but the use of condoms can protect against the sexually transmitted infections also. That is why this is a very very good and a preferred method of contraception among the people. Okay, and also female barriers, there are other kinds of barriers like diaphragms, cervical caps, vaults, and all of these. And along with this, there can be spermicidal creams, jellies to increase the efficiency. So what this does, this will cover the cervix, so there is no chance that the sperm can cross the cervix and go into the system. So if it does not go into the system, then there is obviously no pregnancy. Okay, this is the barrier method. Okay, now moving on to the IUDs. These are intrauterine devices which is inserted into the uterus by a doctor or a nurse. Now, so far the barrier methods is self-usable. Okay, it does not need any intervention, but the IUDs will definitely require a medical intervention to take place. Okay, now non-medicated example is lipase loop. Please remember all the examples, super important. I'm putting 3 stars here. Okay, copper releasing, which is copper T, copper 7 or multi-load 375. Then hormone releasing, we have progestin, cert and LNGs. Now how they work, if you look at the non-medicated, they will increase the phagocytosis of the sperms. Okay, now if you look at copper releasing IUDs, what they do is this copper will reduce the sperm motility and the fertilizing capacity. So even if the sperm comes inside, it will not be able to fertilize the egg. Okay, and hormone releasing is it will release hormones into the uterus in such a way that the hormones will make the uterus not suitable for the implantation. So even if the sperms come in and even if fertilization happens, implantation cannot happen. Okay, and ideally this is used for delaying the pregnancies and is accepted widely in India. Okay, then we have oral contraceptive pills. Now what the pills does is, this is going to be either a progestogen or a progestogen estrogen combination kind of a pill. Now what they do is, when you take it 21 days, okay, preferably within the first 5 days of menstrual cycle, if the person will start taking the pills, what will happen is the body is going to say that, okay, we finished ovulation and we are in the luteal phase. So because of that, ovulation is completely inhibited. Okay, so because of that, what happens is, at the end of 21 days, you should give a 7-day gap when the menstruation will happen. Again, if the woman will start taking the pills, it will tell the brain that, okay, we have finished the ovulation and we have gone to the luteal phase. So ovulation will not take place, and also the uterus is not ready for implantation because we are skipping the entire follicular phase and the proliferative phase, and then the cervical mucus also will hinder the entry of the sperms. Okay, so as a result, even if there are few side effects, this is a acceptable method in India. Okay, so this is an image of the copper T. Now when you look at the oral contraceptives, Saheli is a very important pill because this is a non-steroidal preparation. Please remember that. This was developed by CDRI Lucknow, okay, and this will block the estrogen receptors. So even if the follicular cells are giving estrogen, it will not come and reach the uterus because the receptors are blocked. So as a result, what will happen? The uterus will not proliferate, and as a result, even if the fertilization will happen, the implantation will not take place. Okay, everybody. Now the same concept is applied in the injectables and implants, where the hormones are going to work and prevent any ovulation, and hence it will not, result in any pregnancy. But we can take this as a injection or put it as an implant under the skin also. Okay. Now this will just give a longer effective duration, but the principle is the same. Okay. Now sometimes emergency contraceptions can be used if there is some kind of an unprotected intercourse or a rape or something, and to prevent any possible pregnancy within 72 hours of intercourse, the IUD can be taken, or there is a specific progestogen or a combination pill that can be taken to prevent the pregnancy, but this has to be taken within 72 hours. That is the important point. Okay, now these are all reversible techniques. But if after this also the couple does not want to have any more children, they can go for the surgical method, which is a sterilization technique. So here what we are going to do, in the males, vas deferens is going to carry the sperms, and in the females the fallopian tube is going to transport the ovum. But here what we'll do is, in the sterilization technique, we will cut the vas deferens, we will cut the fallopian tube, and we will stitch it together. So there is a block, so the sperms or the egg will never cross and come to the outside. As a result, there will be no fertilization and no pregnancy. But this does not affect the testis, this does not affect the uterus or the ovary. So all the male hormones will continue to work, and the female also, the normal ovarian cycle, the period cycle, the menstrual cycle, everything will take place, but just that conception or pregnancy is not possible. Okay, so reversibility is very poor, but effectivity is very, very high. Clear, everybody? Now in males it is called as vasectomy, because the vas deferens is removed and is cut and tied. Now how they do this is, they make a small incision in the scrotum and they will carry out the procedure. Tubectomy is the process wherein the females will get sterilized. So a small segment of the fallopian tube is cut and it is just ligated. So how we will do this is, we can make a small incision via the abdomen, or we can also do a vaginal incision also. Okay, so here, since the egg is not going to come out, there will be no fertilization that takes place. Okay, then medical advice and caution. So what kind of contraceptive is better is something that medical professionals can tell. Okay, so these contraceptives can also be used to delay or space the pregnancies, okay, for any personal or social reasons. Okay, and it's not like a requirement, okay, but definitely medical professionals can help as to what can be done for this. Clear, everybody? So this is the diagram of your vasectomy and tubectomy is there in your textbook. So now when you go through it, you will understand. Okay, now why role of what is the role in population stabilization? Definitely because of the use of contraceptions, uncontrolled population growth will not happen. So smaller families can be supported, and that will cause betterment of the family, betterment of resources and everything that is possible. But side effects, definitely there can be nausea, abdominal pain, okay, irregular bleeding can happen, and if there is a long-term usage, it can even be causing breast cancer or cervical cancer in the female. Okay, so even if it's very rare, we should still understand that this is a potential cause of whatever is taken in the body. Okay, now our Xylem has a fast track batch, everybody. So fast track batch is meant to fast track your preparation, so you can even start now and finish your preparation for the 2026 NEET exam. So use the code MEGA15 and get a 15% discount. Okay, and for our Thalapathy batch, which is for the 12 standards, and the VETRI batch, which is for the repeaters, our online coaching currently has a 30% off. So you can join with a code MEGA30, and this will really help you to boost your preparation in the last minute. And for all these notes, definitely do join the WhatsApp community. Okay, now coming to the medical termination of pregnancy, when somebody does not want to carry the child full term and they want to abort the child, they can go for the medical termination, or what is called as an induced abortion. Okay, almost 1/5 of the total pregnancies in the world is aborted. Now there is a lot of debate because there is emotional reasons, ethical reasons, religious reasons, social concerns that are associated with this. But in India, from 1971, we have legalized the MTPs with a lot of strict conditions to ensure that the misuse is not taking place. Okay, now why we need the restrictions is because there is a lot of illegal female feticide that happens in India. So to stop it, we definitely have to check it. Now why generally people should go for MTP? It is because if they have an unwanted pregnancy because of some kind of a casual intercourse, or there is a failure of a contraceptive, or if the pregnancy is due to crimes like rape, then they should not be forced to undergo that pregnancy, right? So they have taken the MTP as a measure to prevent this kind of a pregnancy. So apart from this, okay, so what else conditions can we use MTP for? We can use it if at all, the particular pregnancy is very, very high risk for the mother or for the child, then upon an opinion from a medical practitioner, you can go for a termination of pregnancy. Now the safe period is usually just 12 weeks. Okay, so within 12 weeks it's completely safe, but after 12 weeks it is much more riskier. But given the risk, if at all, like I said, there is a suffering for the baby is suffering from a particular disease, or if the mother cannot carry the pregnancy further, then on such grounds you can definitely go for an MTP. Okay, now illegal MTP is practiced by some unprofessional people. Okay, so that can cause a lot of issues, and sometimes it can even cause death of the mother if it is not practiced properly. And also there is a misuse of amniocentesis. They get to know the gender, and if it is a girl child, they go ahead for the female feticide, which is not correct. Okay, so the sex selective MTP is extremely illegal, and it is very much practiced in India. And so to stop all of this, they have brought about the legal checks. The correct approach is they have to go to a legal qualified practitioner, okay, and looking at the indications. If there are situations that cannot sustain the pregnancy, then somebody should go for the MTP. Okay, so to prevent this, what can you do? We should advocate people about unprotected sex and to explain the risks of illegal abortions. So once there is awareness, it will be easier for the people to choose. Okay, now going to the third segment of the chapter, it is the sexually transmitted infection. Remember that those infections that can spread through a sexual intercourse is what we call sexually transmitted infection, or we can also call this as a venereal disease or reproductive tract infection. Okay, so common STIs include gonorrhea, syphilis, herpes, chlamydiasis. Okay, a lot of these, but HIV is the most dangerous. And remember 3H. Okay, so what is 3H? Herpes, HIV, hepatitis B. Okay, so one more time: HIV, herpes, and hepatitis B. These three diseases cannot be cured. Okay, and over and above, hepatitis B and HIV, both of these diseases can be transmitted from modes apart from a sexual intercourse also. So it need not be only through an intercourse that it spreads. Like for example, sharing needles, surgical instruments, or blood transfusion. If a person doesn't know that they have the disease and they go ahead and donate blood, then through blood transfusion also the person can get the infection, or from a mother to child also it can spread. Okay, so these diseases have to be definitely monitored before we go ahead for a blood transfusion or any pregnancy or anything like that. Okay, now curability, like I said, hepatitis B, herpes, and HIV. These are the most dangerous three, out of which HIV is the most dangerous. And apart from these three, if there is any other disease, then the initial stage of symptoms will be like itching, fluid discharge, slight pain, swelling, and other things. Okay, and the females may be mostly asymptomatic. Okay, so detection is slightly difficult. But if there is a doubt, okay, if there is a certain person has a doubt of whether they are prone to a sexually transmitted infection, or if they have sex with multiple partners or unknown partners and conditions like that, then definitely it is advisable to go and get it checked at the earliest, so that in the early symptoms all the other disease can be cured. Now in the complicated stage, what we can have is a pelvic inflammatory disease. We can have abortions, stillbirths, ectopic pregnancies, okay, infertility, or reproductive tract cancer and other things is definitely possible to happen. Okay, now when it gets to this kind of a complicated situation, definitely it is difficult to solve the problem or to treat the disease. So as early as possible, if you find out, it will be better. Okay, so most vulnerable is the 15 to 24 year old age group. Okay, but to prevent this, definitely avoid sex with multiple partners, unknown partners. Always to use a condom so that it can protect you from STIs. And also early detection and thorough checkup is important, so that in case you are detected at an early stage, you can always cure it at the earliest. Okay, now why reproductive health is a major concern over here is because definitely overall, if there is no early detection and most of the society is inflicted with such kind of disease, then it is not a very reproductively healthy society, right? So to cure this, to detect this is also part of reproductive health programs. Now the last part of the chapter is about infertility. Now infertility is if a couple is trying to have a child for more than 2 years and still not able to have a child, then we call the couple as infertile. Okay, now usually females are blamed, okay, but there are many times where the problem is male related also. Okay, so today there are many infertility clinics that can help to diagnose these conditions and to treat these conditions. Okay, now for such couple who cannot conceive naturally, we have certain technologies which we can help to cure the disease, which is assisted reproductive technologies. Okay, so in that first we have in vitro fertilization. That is, if fertilization cannot take place in the body of the woman, then what we can do is we can collect the egg, collect the sperm and undergo this fertilization outside the body in the laboratory condition. That's what we call IVF. And once the zygote is ready, either we can transfer the zygote directly into the fallopian tube, okay, so that it will start the cleavage division and continue for implantation, which is zygote intrafallopian transfer, or we can keep it in the lab until it reaches about 16 cell stage and then release it directly in the uterus, which is the intrauterine transfer. Now both of these come under the embryo transfer, which is transferring the zygote after fertilization into the body of the woman. Okay, so ZIFT and IUT are two different kinds of embryo transfer. Now apart from this, if we want to try out fertilization inside the body of the woman, then we can transport the gamete directly, so that will be gamete intrafallopian transfer. Additionally, there will be intracytoplasmic sperm injection, meaning you can directly take the sperm injected into the egg if natural fertilization is also a problem. Okay, apart from the gift, which is gamete intrafallopian transfer, you can, so in gamete intrafallopian transfer you will be transferring the egg. Okay, in artificial insemination you will be transferring the sperm. So artificially you can take the sperm and you can put it inside the female, or you can directly release it in the uterus, called as the intrauterine insemination. Okay, so these are the different techniques that can be used. So we can use the egg and sperms collected from the partners or from the donors and we can put it inside the body. Okay, now AI technique is nothing but artificial insemination. Semen is collected from the husband and it is put into the female of the body. Why do we do that? Because if there is lower sperm count or the male is not able to inseminate, then we will go for the AI technique. Okay, but limitations is that definitely it requires expertise, it requires a lot of cost because it's an expensive equipment. Okay, and currently there are very few centers in India that can actually do this on a proper basis. Okay, and also there are social and emotional factors that is involved. Okay, so sometimes they don't want to use the donors gametes. Okay, so these kind of factors definitely do affect. And also adoption is definitely a very much legal thing in India. So as a couple, if they're not able to have children, they can definitely go for this positive alternative. Okay, now, male infertility statistics in India includes the fact that almost 40 to 50% of infertility cases is male related. Okay, and female infertility is only 3.9 to 16.8% depending upon the age of the female. But sadly, because there is no awareness, okay, they don't go for treatment and they often just blame the women. Okay, so to be honest, this fertility factor can be corrected by a lot of lifestyle issues also, like smoking, obesity, stress, environmental toxin. All this play a very major role. Okay, and treatment outcome is that even if you use assisted reproductive technology, it is not like a guarantee. It can only improve the chances of pregnancy, but again it will incur a lot of cost, a lot of infrastructure and other things that is difficult to manage. Clear, everybody? So with this we are done with the warm-up session for the reproductive health. Xylem's fast track batch has already started. So if you're preparing for NEET 2026, this is the time for you to join, and you can use the code MEGA15 and get a 15% off on the courses. And if you are studying 12th standard, then we have the Thalapathy batch, and if you're the repeater, we have a VETRI batch. Both of these are now having a 30% off, so you can use the code MEGA30 and join our courses. Okay, so I hope this class was useful to all of you. Definitely do scan the QR code so that you can get all the notes at your fingertips in our community. Okay, so for all the other notifications and all the series related updates, definitely do follow our channel. Okay, so subscribe if you still have not subscribed, and I'll see you all in the next class. Take care. Bye bye.